Could you recognize the early signs of prostate cancer if your life depended on it? Every year, thousands of men unknowingly carry a ticking time bomb inside their bodies, undiagnosed prostate cancer. And here's the sobering truth: prostate cancer affects 1 in 8 men. Yet, catching just a few early warning signs can make the difference between life and death. Think I'm exaggerating? According to the American Cancer Society, over 288,000 men will face a prostate cancer diagnosis this year. Even more tragically, nearly 35,000 of them will lose their lives to it. But here's the silver lining: when detected early, the survival rate skyrockets to an astounding 98%. Yes, you heard that right, 98%. So, why do so many men miss these critical signs? Assumptions like "I'm too young" or "I'm healthy, this can't happen to me" have led countless individuals down a dangerous path. Prostate cancer doesn't discriminate based solely on age. Family history, ethnicity, lifestyle, and even diet can play a major role in your risk. In the next few minutes, I'll break down 8 subtle but life-saving signs of prostate cancer that every man needs to know. This isn't just information, it could be the most important health lesson you'll ever hear. Let's get started. 1. Frequent urination and nocturia. Does it feel like your bathroom habits have taken over your life? Frequent urination, especially at night, is a subtle yet significant sign that something might be wrong with your prostate. Normally, most adults can go about 3 to 4 hours between bathroom visits during the day and sleep a full 6 to 8 hours without interruption at night. However, when prostate issues arise, these patterns can shift dramatically. Frequent urination is not just about drinking too much water or having a small bladder. The prostate, a small gland located below the bladder, plays a critical role in regulating urinary flow. As the prostate enlarges, whether due to benign conditions or something more serious like prostate cancer, it can put pressure on the bladder and urethra. This can cause a sudden, frequent urge to urinate, even when your bladder isn't full. Nocturia, or waking up multiple times during the night to urinate, is an even more disruptive symptom. While aging and certain medications can contribute to this, persistent nighttime trips to the bathroom are not something to dismiss. Each interruption to your sleep cycle could be a signal from your body that your prostate needs medical attention. 2. Painful ejaculation. Sexual health can be a difficult topic to discuss, but ignoring symptoms like painful ejaculation could be putting your overall well-being at risk. Pain during ejaculation is not just a fleeting discomfort, it's often a warning sign of underlying issues with your prostate. This symptom can manifest in several ways. You might feel sharp pain in your penis, a throbbing sensation in your testes, or even a deep ache in your lower abdomen or rectum. While the intensity can vary from mild and tolerable to excruciating, the cause is often rooted in changes to the prostate. As the prostate becomes inflamed, enlarged, or affected by cancer, nearby nerves and tissues can be impacted, leading to discomfort during ejaculation. What makes this symptom particularly concerning is how easy it is to dismiss or overlook. Many men might write it off as stress-related or assume it's temporary. But persistent or recurring pain during ejaculation is not normal. It could signal conditions such as prostatitis, prostate inflammation, benign prostatic hyperplasia, BPH, or, in more serious cases, prostate cancer. Duration also matters. Pain that lingers for just a few seconds may seem insignificant, but if it consistently disrupts intimate moments or lasts longer, it's your body's way of saying something isn't right. This type of pain doesn't just affect physical health, it can also impact emotional well-being and relationships, adding stress and strain to your life. 3. Blood in urine or semen. Seeing blood where it doesn't belong, whether in your urine, hematuria, or semen, hematospermia, can be alarming, and for a good reason. These symptoms are not normal and may indicate underlying issues with your prostate that require immediate attention. Your prostate is intricately connected to your urinary and reproductive systems, surrounded by a dense network of blood vessels. When something disrupts this delicate balance, whether it's inflammation, an infection, or a tumor, bleeding can occur. In cases of prostate cancer, a growing tumor may press against or damage nearby tissues and blood vessels, causing microscopic tears or more significant vascular damage. The appearance of blood can vary. It may be a faint pinkish tint or bright red streaks in your urine or semen. Alarmingly, this symptom often occurs without pain, making it easier to overlook or dismiss. However, its presence is a clear sign that something isn't right. It's important to note that while blood in urine or semen can signal prostate cancer, it's not the only possible cause. Infections, kidney stones, or benign prostatic hyperplasia, BPH, could also lead to this symptom. But that doesn't mean it should be ignored. Only a doctor can determine the root cause. Remember, your body is sending you a clear message. Blood in urine or semen is never normal and should always be taken seriously. Acting quickly could save your life, giving you peace of mind and, potentially, life-saving treatment. 4. Pain while sitting. Sitting is something most of us take for granted, but for men with prostate issues, it can become an unexpected source of discomfort. If you're experiencing pain while sitting, especially in the pelvic region, lower back, or tailbone area, it could be a sign of an enlarged or problematic prostate. The prostate gland is located just below the bladder and in front of the rectum, meaning it's surrounded by sensitive areas that bear weight when you sit. When the prostate becomes inflamed, enlarged, or affected by cancer, it can exert pressure on surrounding tissues, causing pain that radiates through the pelvic area. This pain is often described as a dull ache, but it can also feel sharp or stabbing, making sitting for extended periods almost unbearable. Whether you're at work, driving, or relaxing at home, the discomfort can disrupt your daily routine and lower your quality of life. In advanced cases of prostate cancer, the pain may become more persistent and spread to other areas, such as the lower back or hips, as the cancer grows or spreads to nearby structures. However, even in its early stages, prostate-related pain during sitting is a symptom worth paying attention to. While pain while sitting can have other causes, such as hemorrhoids, muscle strain, or sciatica, persistent or worsening discomfort should not be ignored. 5. Pain in back, hips, or chest. Pain in the back, hips, or chest might seem unrelated to the prostate, but it can actually be a serious warning sign of advanced prostate cancer. When prostate cancer spreads, or metastasizes, it often targets the bones, making these areas hotspots for persistent and unusual pain. Unlike typical aches caused by muscle strain or overuse, cancer-related bone pain is often deep, intense, and unrelenting. The pain in your lower back or hips may feel dull at first, but over time, it can become sharper and more debilitating. Similarly, chest pain might occur if the cancer has spread to the ribs or sternum. These pains are not random, they're the result of tumor cells invading and disrupting the normal structure of your bones. Prostate cancer's affinity for spreading to bones is one of its most concerning traits. As cancer cells grow within the bones, they weaken the structure, sometimes leading to fractures or extreme tenderness. This process also stimulates the nerves in the affected areas, amplifying the sensation of pain. It's important to note that pain in these areas doesn't always mean cancer. Common issues like arthritis, sciatica, or injuries can also cause similar discomfort. However, when bone pain persists, worsens over time, or occurs alongside other prostate cancer symptoms like frequent urination, blood in urine, or unexplained weight loss, it's critical to seek medical evaluation. 6. Swelling in legs or feet. Unexplained swelling in the legs or feet might seem unrelated to prostate health, but it can actually be a warning sign of advanced prostate cancer. This symptom often occurs when cancer spreads beyond the prostate and begins to affect the lymphatic system, which plays a crucial role in fluid drainage and immune response. The lymphatic system is a network of vessels and nodes that helps remove waste and excess fluid from the body. When prostate cancer cells invade lymph nodes in the pelvis or other areas, they can block the natural flow of lymphatic fluid. This blockage leads to fluid buildup in the lower extremities, resulting in swelling, also known as lymphedema. This swelling isn't like the puffiness you might experience after sitting for long periods or consuming too much salt. It tends to be persistent and may cause your legs or feet to feel heavy, tight, or even painful. The skin over the swollen area might appear stretched and shiny, and in severe cases, it could develop redness or tenderness due to inflammation or infection. It's important to recognize that while swelling in the legs or feet can be caused by less serious issues like poor circulation, kidney problems, or heart failure, it becomes more concerning when paired with other potential signs of prostate cancer, such as frequent urination, pain, or weight loss. 7. Unintentional weight loss. Unintentional weight loss might sound like a welcome surprise to some, but when it happens without effort, no dieting or increased physical activity, it's often a red flag for underlying health problems, including advanced prostate cancer. Cancer cells are notorious for being energy thieves. As they grow and spread, they consume an extraordinary amount of the body's resources, disrupting normal metabolic functions. This leads to a condition known as cancer-related cachexia, a complex syndrome characterized by muscle wasting, fat loss, and a significant drop in overall body weight. For men with prostate cancer, unintentional weight loss can signify that the disease has progressed beyond the prostate gland. It might occur alongside other systemic symptoms, such as fatigue, loss of appetite, or pain, which further exacerbate the weight loss. This isn't just about numbers on a scale, it's a sign of your body struggling to keep up with the metabolic demands of the cancer. It's essential to understand that while weight fluctuations are normal to some extent, a sudden and noticeable drop in weight, say 5% or more of your body weight within 6 months, without changes in your diet or exercise routine is a cause for concern. Although weight loss can result from numerous non-cancerous conditions, such as thyroid disorders, gastrointestinal issues, or chronic stress, it should never be ignored, especially if other prostate cancer symptoms are present. 8. Numbness or weakness in limbs. Numbness or weakness in your arms, legs, or other limbs might not seem connected to prostate health, but it can be a significant sign that prostate cancer has spread to more advanced stages. When prostate cancer metastasizes, it often targets the spine, which can cause neurological symptoms, including numbness and weakness in the limbs. The prostate is located near the spine, and as cancer grows, it can put pressure on the spinal cord or nearby nerves. This pressure interrupts the normal functioning of the nervous system, leading to sensations like numbness, tingling, or weakness in the arms and legs. The problem arises when the cancerous cells invade the spinal column, blocking nerve signals and affecting motor functions. Numbness or weakness caused by prostate cancer typically doesn't happen suddenly, it usually develops gradually and may worsen over time. This type of pain or discomfort is different from the temporary numbness you might experience after sitting too long or sleeping in an awkward position. The numbness linked to prostate cancer can spread to multiple limbs and cause significant difficulty in movement, often accompanied by muscle weakness. In more severe cases, you may also experience loss of bladder or bowel control, as the cancer affects the spinal nerves responsible for these functions. With that said, recognizing the early signs of prostate cancer could literally save your life. It's easy to dismiss these symptoms, but being proactive about your health and getting checked regularly can make all the difference. If you or someone you know is experiencing any of these signs, don't wait, consult with a healthcare professional. Early detection is key to successful treatment. If you found this video helpful, make sure to like, subscribe, and share it with others who might benefit. We'll be back with more health tips, so don't forget to hit the notification bell to stay updated. Until next time, stay healthy and take care.